So hi everyone, this is Dr.Aswhin Kumar, orthopedician, works in KR Hospital, High Tech City branch. Today we're going to discuss about hip replacement, the most commonly heard and the most commonly done replacement. There is a hip replacement. So when you will get this hip replacement done, there are few conditions. One is arthritis, which comes in elderly, and avascular necrosis, which is increased these days because of COVID in young and elderly also. And some people like elderly with intercapsular fracture, that fracture neck of the femur, like if you have a fracture over here, you can't treat it with the nails and rods, you have to replace it. So these conditions where you will go for hip replacement surgery. So what we will do in the hip replacement surgery, so normal hip will be like this. You will be having a ball and a socket where you will be having movement around which you will walk and sit and go on there. So when the thing like arthritis or whatever the fractures will happen, this won't work properly. So then what we will do, we'll replace with it two metal components. So what we will do, we'll open the joint and we will see, and this is your thigh bone and this is your hip bone. So where what we will do, we'll remove the diseased part. So we'll remove all this dead part and from the acetabular side also. So then we'll replace it with the femoral canal is prepared, the thigh bone is prepared, and a stem like this metal will be kept over there with the ball. Then we will prepare the acetabulum, like on the hip side. We'll replace, we'll take out all the dead tissue and the damaged part, and we'll keep a socket like this, which will articulate with this thing, and the movement will occur over here. So doesn't have any sensation, so movement over this area won't have any pain. So people who are having pain while walking before surgery won't have pain because these were non-sensitive, so you can walk on without pain. So this is how we will do the surgery. So what is the precautions, like going for a patient having avian or arthritis, so those people will be having more pain and muscle all tight around the hip joint. So we will release those muscles a little bit and we'll go to the joint and we'll do the surgery. So what will happen after the surgery? So after the surgery in the evening or what, we'll keep you in the SIC, like emergency, then we'll shift you to the ward. In the next day of the surgery, we'll make you walk with the help of a walker. So there is no time like rest. So immediately after the surgery, in the next day we'll make you walk and you will feel the comfortableness and you will come to know how pain free it is. So whatever the mild pain, that is because of the surgery, but not the original pain that you have previous to the surgery. So what complete recovery, it will take around 2 to 3 weeks. Why? Because your muscles has to relax and the pain has to go, and the muscle, you have to accommodate for it. So within 2 to 3 weeks you will completely free from pain and able to walk on your own with my minimal support. After 1 month you will take off the walker also. So it is a gold standard for avian and hip IC fractures. Types of replacements are partial and complete. Normally they will think partial or total. So partial means only we will change the head part, not the hip part, like thigh part only we'll change it with the ball, other part will be the intact only. So after that one we'll reduce and you are able to walk without any pain. This is done only in elderly, like about around 80-90 age, and with fracture this part of the thigh bone, neck fracture. So there you will only go for the partial. Whoever is able to do their activities before the fracture or arthritis or younger will go with the total replacement, that is replacing both the sides of the hip joint. So this is called the total hip replacement or complete replacement of the hip. And so many myths are there, people thinking that after the surgery they may not be able to walk and all, but it is not true actually. After getting the surgery, so many people are feeling very happy for that one. So why? Because they don't have any pain, they are able to do their routine activities without any help, anyone's help. So actually it is a good thing to get done. So don't worry about the surgery, how it is going to be and all. So the results will be very fine and you will be happy after the surgery.